Western New South Wales PHN is committed to improving the health and wellbeing of Aboriginal and Torres Strait Islanders.
I feel very fortunate to be able to work on Aboriginal lands across the region that the PHN covers. And for me, NAIDOC Week is an important opportunity to celebrate the resilience, the diversity and the beauty of Aboriginal culture. It's also a time for us to pause and reflect on the work that we do with our partners and to really think about how we can best make a meaningful difference for all Aboriginal people.
So one of the things we're doing as an organisation is we're putting together a plan on how we in our region will address the closing the gap targets and trying to localise it and make a real contribution.
The health and wellbeing of Aboriginal and Torres Strait Islander people living in our region really is the responsibility of everyone. In our sphere of influence and with our partner organisations, we're really working hard to continually improve how we collaborate with respect and in the true spirit of partnership to really deliver and facilitate those community-led initiatives that will really make a thoroughly positive impact to the well-being of Aboriginal and Torres Strait Islander people.
So we play a very important role in closing the gap for Aboriginal and Torres Strait Islander people. We work, in a lot of communities across our region, particularly here in Western New South Wales. We work with many, important key stakeholders in identifying, what the needs are for our Aboriginal people, and we are working, in partnership to address, the health outcomes for Aboriginal people.
The PHN works collaboratively with community to design and develop services that are appropriate for the Aboriginal and Torres Strait Islander communities.
Stakeholders and community engagement is so important for Aboriginal people and Aboriginal health. Our stakeholders, are the voice of our community. It's so important to maintain trust and have meaningful relationships, so we understand what the needs are for our Aboriginal people.
The Community Education Initiative works towards improving the health and wellbeing of Aboriginal and Torres Strait Islander peoples. Bowel screening is our main focus. Aboriginal people have low screening participation rates, so I'm striving to improve this by increasing the awareness of how important and simple bowel screening is so that people get screened, diagnosed and treated much earlier.
We are really proud of our Reflect Reconciliation Action Plan, where we are committed to engaging our staff in our reconciliation journey.
We promote inclusion and greater cultural understanding through projects like the Reconciliation Action Plan. The Aboriginal Engagement Strategy, so that's designed to promote better communication and understanding from our staff with the Aboriginal communities throughout our region. Part of that is also developing a cultural safety step plan or training plan for our staff. Ultimately, the Aboriginal community is who we serve, so we need to listen and take part in community events and also discussions around health services and include them as partners with the design of health initiatives and programs going forward.
Western New South Wales PHN is committed to closing the gap to improving the health and wellbeing of Aboriginal and Torres Strait Islanders.
NAIDOC Week 2022.
Get up.
Stand up.
Show up.